Welcome to our patient education program hosted by Hashir International, Specialist Clinics and Research Institute for Misophonia, Tinnitus and Hyperacusis. Hashir International is a multidisciplinary organisation which aims to help you with assessment and management of your misophonia, tinnitus or hyperacusis. Each month, we will be exploring a different topic within sound sensitivity, aiming to give you a broader knowledge and understanding of these conditions. My name is Joanna Barker, and I'm your host for these sessions. I've been an audiologist for the last 12 years, and I'm a specialist in misophonia, tinnitus, and hyperacusis. Sound sensitivities are my passion, and I'm really excited to bring these live sessions to you each month. So today we're joined by Dr. Maria Morrison, co-owner at Geneva Hearing Services and Hearing Care Clinic of Downers Grove and creator of Tinnitus Relief, an online course that guides people to take control of their tinnitus and reduce the impact on their life. Dr. Morrison is presenting her talk From Ringing to Relief, Your Guide to Tinnitus Solutions. In this talk, Dr. Morrison will be giving us more insight into what tinnitus is, why it is bothersome, and strategies people can use to reduce the impact. There will be the opportunity to ask questions, so please pop your questions in the live chat and we'll get to those after the presentation. Thank you so much, Dr. Morrison, for joining us. I will now hand over to you.
Wonderful. Thank you so much, Joanna. I'm going to go ahead and share my screen,
Thank you.
and hopefully you can see that okay.
That's
Wonderful.
brilliant.
Great. Well, first, I want to take a moment and sincerely thank you all for being here today. I know how busy life can be, and the fact that you've set aside time here to join us means a lot. Tinnitus can feel overwhelming at times, but knowledge truly is a powerful tool. And just by being here, you're taking an important step towards understanding and managing it better. And I'm truly honored to spend this time with you. So thank you. Just a little bit of information about me. I am an audiologist and tinnitus specialist, and I personally experience tinnitus. So I very much understand what my patients are going through. When I earned my doctorate degree way back in 2003, there was very little training on how to truly help those struggling with tinnitus. After graduation, I sought out additional education and specialized training of my own, and I began with tinnitus retraining therapy, TRT, under the incredible Dr. Jastreboff. And over the years, I've incorporated additional approaches like progressive tinnitus management, linear, and other evidence-based options. In 2006, my business partner, Rich Bick and I, we opened Geneva Hearing Services, and shortly after, I started helping members of our community find relief from tinnitus. As I realized how many patients were receiving poor and even harmful advice from providers who lacked proper tinnitus education, I became passionate about changing that, and I actually created an online training course specifically for audiologists to help them deliver better evidence-based care in their own communities. I truly believe that if more people had access to accurate information, tinnitus wouldn't be so devastating as it currently is. And more recently, as Joanna mentioned, I launched an online course for patients themselves, the Tinnitus Relief Program. Because my license here in Illinois, the way it works in the States is it limits me to providing direct care with only those who are physically in the state of Illinois. And I wanted a way to help those who either can't travel to me or maybe can't afford an individual consultation. And so the online course offers the same foundational strategies that I teach one-on-one. These are tools and techniques people can start using immediately to reduce the impact tinnitus is having on their daily life. And some of those strategies we're going to actually talk about and cover today. So this presentation really is geared towards everyday people who are suffering with tinnitus. Healthcare providers, you can still benefit from this talk, especially if you don't have a strong background in tinnitus. I truly believe that knowledge is power, and that's what I want to give you today. By having a better understanding of your tinnitus, you'll be better able to make an informed decision about your own hearing health care. Now, of course, a disclaimer, this presentation is to provide general information about tinnitus, right? It is not intended to provide medical advice or actual treatment for your specific case. If you or a loved one are experiencing tinnitus or anxiety or depression, I recommend that you see your primary care physician or schedule an individual tinnitus consultation with a specialist near you. Now, we're going to cover lots of things today. Of course, more background information on tinnitus, who it affects, how it affects them, but most importantly, which is why most people come on to these types of webinars, is what's available, what treatments are out there to help reduce the impact. So what is tinnitus? Well, it's a sound, right? That's all it is. It's a sound that you hear in your ears or your head, and there's no external source. So if it's just a sound, why is it so bothersome? Right? We hear sounds all day long that don't bother us. We don't react to them. The refrigerator fan in your kitchen is a great example. The fan kicks off and kicks on all day, and we don't react to it. We don't sit in the kitchen with our morning cup of coffee and think, how am I supposed to get anything done with that fan noise going on and off all day? Right? We don't react this way because our brain has determined that that fan is not important. It's not a threat. Our brain has habituated to it, and so the brain filters it out, doesn't even hear the sound. We don't realize it's making a noise unless we pay attention to it. Well, what if I told you we can do the same thing with tinnitus? We can get your brain to habituate to the tinnitus, to push it into the background. It is possible, so stick with me and I will show you how. Now, is it tinnitus or tinnitus? Well, either is correct. Again, it's a sound that we hear in our ears or our head, and it's not coming from our environment. Some people will hear it constantly, others intermittently. It can fluctuate in loudness and pitch, and some have described it as like a ringing, humming, buzzing, whooshing, crickets, chirping, roaring. Mine, I like to call it bacon frying in a pan. I like bacon, and so I just like to give it a little positive spin of what it sounds like to me. But it can be many different sounds, and there isn't a wrong or right type of sound, right? It's very prevalent. It's estimated 749 million people worldwide experience tinnitus, and over 120 million people don't just notice their tinnitus, they live with it every day as a real challenge that impacts their lives and pushes them to seek answers. If that's you, you are not alone. There is help, hope, and a way forward. You are here today taking action, and that already puts you on a path towards real change. Now, tinnitus doesn't play favorites. It can show up in men and women and young people and older adults, really anyone from any walk of life. That said, we do know that it tends to be a little bit more common in certain groups, like men, older adults, blue-collar workers, people dealing with certain health conditions. But no matter who you are or how long you've been dealing with it, there's always hope. Tinnitus may be a part of your story, but it does not have to define your future. And today is all about giving you the tools to move forward. Now, what causes tinnitus? The exact physiological cause of tinnitus isn't yet fully understood. However, research has consistently shown that there are several likely causes and triggers. So these can include hearing loss, noise exposure, certain medications, head or neck injuries, and stress. And we're going to talk about those in just a few moments. While the root cause may be different for each person, understanding the possible triggers is an important step towards managing it more effectively. Now, when patients come into my office, one of the first things we do is a medical evaluation to make sure there's no underlying medical concerns that we need to address. We're looking for certain red flags like, is there a difference in hearing between the ears? Does one ear hear really well and then another ear not so well? Does tinnitus only occur in one ear? Does your tinnitus pulsate with your heartbeat? These signs can sometimes indicate a medical issue that needs further evaluation by an ENT specialist. But let's go ahead and talk about some of those common causes or triggers. So of course, noise exposure. It's the number one cause of tinnitus for most people. It can happen whether or not there's an obvious hearing loss. Sometimes it builds up slowly, so from repeated unprotected exposure to loud sounds like factory work, construction, or landscaping equipment. Other times it strikes all at once, after a single powerful blast like a gunshot, firecracker, or explosion. Tinnitus, often paired with that muffled feeling, is one of the first warning signs that your ears have taken a hit. It's the body's way of saying, hey, something is not right. That's why protecting your hearing is so important, not just for avoiding tinnitus, but for protecting your long-term hearing health. If you know you're going to be in noise, whether it's a concert, a shooting range, using the lawnmower, please wear hearing protection every single time. It's the easiest and most powerful thing you can do to prevent further damage. Now, hearing loss is often caused by noise trauma. but it can also happen for a lot of other reasons like aging, genetics, certain health conditions, or even side effects from medications. In general, anything that causes a hearing loss can also bring on tinnitus. Now, we know that hearing loss and tinnitus are closely connected, but here's something to keep in mind. Not everyone with a hearing loss will have tinnitus, and not everyone with tinnitus will show a hearing loss. So everyone's journey is a little different. Tinnitus isn't always just about the ears. A number of health conditions that affect the whole body have been linked to tinnitus, including cardiovascular disease, high blood pressure, thyroid problems, fibromyalgia, depression, multiple sclerosis. The list goes on and on, right? Even everyday factors like poor diet and lack of exercise can set the stage for tinnitus to start or get worse. The truth is, our bodies are incredibly connected. And sometimes tinnitus is the body's way of waving the red flag and say, hey, something needs attention. Head and neck injuries are another common trigger for tinnitus. Many people report that their tinnitus started after some kind of trauma, like a skull fracture, whiplash injury, or a blow to the head or face. Of course, jaw problems like TMJ disorders can also increase the risk of developing tinnitus. You have to remember, injuries in this area can disrupt the delicate systems connected to hearing imbalance and make the onset of tinnitus more likely. And unfortunately, about 500 medications, both over the counter and prescription, will list tinnitus as a potential side effect. Some of our biggest offenders are antibiotics, common painkillers, and even chemotherapy drugs. Now, that doesn't mean that everyone who takes those medications are going to get tinnitus, but if you notice a ringing or buzzing after starting something new, it's definitely worth paying attention to. And it's not just medications. Research shows there's a number of everyday factors that can make your tinnitus feel even worse. So things like caffeine, alcohol, salt, noise exposure, stress, and anxiety. Stress is a huge aggravating factor for all of my patients. You know, my dad always jokes, the only guarantees in life are death and taxes. And I say the only guarantees in life are death, taxes, and stress is going to make your tinnitus worse, right? We know that if we are under a lot of stress, our tinnitus is going to jump up. So the main question that could be on your mind is what treatments are available and is there a cure? And unfortunately, there is technically no cure, but there's absolutely management options to provide relief. And it's important to know that not all treatments are created equal. Some are backed by strong clinical research and others not so much. So right now, there is no medical or surgical treatments that can cure tinnitus. I know there's a lot of hype online about cannabis getting a lot of attention, but really there hasn't been any research to show it to be effective long term. There's many different medications that have been studied, but again, there's not a single drug that directly treats it. Now, some physicians may prescribe medications to help manage secondary issues like sleep disturbances, anxiety, depression, and sometimes taking medication for those issues can indirectly make tinnitus feel more manageable. As for medications, of course, always I recommend discussing those options directly with your healthcare provider or your pharmacist, and they can help you decide which is going to be right for your specific situation. Now that we've covered what can trigger tinnitus, let's talk about how it can impact your daily life. People with tinnitus often struggle in 4 key areas. So, of course, sleep. People might find it hard to fall asleep, stay asleep, or they might wake up feeling not really rested. Hearing issues are very common. Tinnitus can make it harder to understand speech, but especially because many patients with tinnitus also have some level of hearing loss. Emotional distress, feelings of frustration, sadness, irritability, depression, very common. And of course, concentration problems. So it can be tough to stay focused, leading to mental fatigue and confusion. It's important to remember not everybody's going to experience all of these challenges. And when you do, it can vary widely in its intensity. But whatever you're feeling, whether it's a little struggle or a heavy burden, your experience is valid and you are not alone in it. Now, in more severe cases, tinnitus can interfere with a person's ability to work, concentrate, and function day to day. It can even contribute to serious psychological conditions like depression, post-traumatic stress disorder, anxiety disorders, anger issues. If you or someone you care about is struggling with these, please reach out for support. Talk to your primary care physician, talk to a psychologist. Help is available, and no one should have to face this alone. All right, so now we're going to switch gears and talk a little bit about how we hear and why understanding this and hearing process is so important when it comes to managing tinnitus. So you may or may not already know, our ear is built up of three parts. We have the outer ear, the middle ear, and the inner ear. When you get your hearing evaluated, whether you're wearing the headphones or the inserts, we're testing all three parts of the ear. So when sound is collected, we have our pinna, right? Acts as a funnel. It's going to funnel sound into the ear canal. When sound goes into the ear canal, it's going to vibrate the eardrum. When the eardrum vibrates, it causes these three tiny bones to rock back and forth. So fun fact, those three tiny bones are called ossicles, and they're the smallest bones in your body. But those three tiny bones will rock back and forth. At the end of that chain is actually a window. And so when those bones are rocking back and forth, a window is moving and it's pushing fluid in the snail-like structure called the cochlea. And when the fluid is moving in the cochlea, it stimulates these hair cells and it sends electrical impulses up to the brain. And that's how we hear. And so I love to just take a moment here and just recognize how amazing our bodies are, right? First and foremost, I only understand the ears, right? I don't, the heart, the lungs, the digestive, like it's all amazing. But the ear will pick up acoustic energy. So it could be you're hearing a baby crying and a woman speaking and traffic noise. All of those sounds are acoustic energy. Your ears are picking that up. It transfers it from acoustic energy to mechanical energy with the movement of the eardrum and those little bones, right? And then it goes from mechanical energy to electrical energy when those hair cells are stimulated and it sends electrical impulses up to the brain. And somehow, through all of that, the brain can tell that's a baby crying, that's a woman speaking, that's traffic noise. I mean, just it's mind blowing to me. Again, I'm an audiologist, so I geek out on this stuff, but I just taking a moment and realizing how amazing our hearing system is. Now let's go back to that cochlea. This is a picture of the hair cells. These are the inner hair cells of the cochlea. This is what we want them to look like. Like, look at these, just the gorgeous picture of healthy hearing cells. Now, when we have hearing loss due to maybe noise damage or genetics or medications, those hair cells become damaged and bent. When this happens, the sound that goes up to the brain is a little distorted. It doesn't sound the same way as it did when our hair cells were healthy. So if you've ever talked to someone who wears hearing aids, they will tell you, I hear better, but I don't hear like I did when I was 20. Yep, that's correct. One, we don't have the brain of a 20-year-old, right? But also the signal that the brain is receiving is not the same signal as when we had healthy hearing. Now, if you've ever heard that like little or it's like this little high-pitched tone, it's less than 30 seconds, we believe that to be one of those hair cells are dying off. So when you hear that, you can, say a little prayer for your friend who's now gone. But luckily, we have thousands of them. When one passes, it's not that big of a deal. It's when many pass in the same section that's going to cause a hearing loss. So going back to how we hear, what's collected on the right ear is going to be processed on the left side of the brain. What's collected on the left ear is going to be processed on the right side of the brain. And while we are processing sound, different parts of our brain can be activated. So of course, when we're listening to sounds, the auditory part of our brain is being activated, right? It's listening to sound. But there's other parts of our brain that can turn on and fire. And one of those is called the amygdala. It's where your fight or flight system is. So I want you to picture we are going for a walk in the woods. It's a beautiful spring day. The birds are chirping, the wind is rustling the leaves, and we're just enjoying our walk, right? But now we hear a sound. That sound is going to activate my fight or flight system because I think it could be a snake. And this is not part of the story. I am 100% afraid of snakes. It would absolutely activate my fight or flight system. So what's really cool about our bodies is it hears this sound, this, right? It activates the fight or flight system. And now our body is preparing to fight or flee, right? Our muscles are going to tense. Our heart rate's going to increase. Our blood pressure is going to rise because our body is determining, do I need to fight the danger or flee? I'm not fighting a snake. I'm fleeing from it. I just want to find out where it is so I can run in the opposite direction, right? So what's really cool is in addition to all these things that are going on to prepare us to fight or flee, is it can actually make the sound louder to make it easier for us to find it. So it can make that sound louder so I can find it and then flee from it, right? It's how our brain is reacting to a threat. It's very similar if you've ever been home alone and it's completely dark, it's the middle of the night, 2 a.m., and you hear maybe floorboards creak and you think, oh, is someone breaking into my house? And so when that happens, you hear the foreblur peak and you have this, oh, is someone breaking into my house? Your fight or flight system's activated. Your amygdala's firing like crazy, right? You are now able to hear all those soft sounds that you didn't even notice before when you were sleeping. You didn't even notice those sounds, but now you hear them very distinctly because your brain is protecting you. It's trying to keep you safe. And this is what happens with tinnitus. When our brains hear tinnitus, it will determine all on its own. It will determine whether or not it's a threat. If it determines it's not a threat, those are the patients who are just, it's kind of there in the background. They don't even notice it, right? If it determines it's a threat, it's going to pay attention to it, right? And then we feel anger, frustration, annoyance, worry, concern. And because we have this emotional reaction, it reinforces the brain's decision that this is a threat. We need to pay attention to it. And so it makes it louder, which makes us more angry, frustrated, annoyed, worried, concerned. And we get into this vicious cycle. And so the way that we treat tinnitus, the way that we manage tinnitus is we have to break that cycle. We have to get the brain to recategorize it from it's a threat to it's not important, like the refrigerator fan from earlier, right? And we can do this through a couple of different ways. Now, when it comes to tinnitus, I believe it's important to attack it from many angles. We know that there are many different causes of tinnitus. We know that there are many things that can make it worse and aggravate it. And so managing it successful means approaching it from several different directions at once. Now, the 4 circles in the center represent what I consider the 4 foundational elements of a tinnitus management program: sound enrichment, relaxation exercises, changing our thoughts, and getting good sleep. Now, these are the core strategies I focus on during my in-person consultation as well as with my online tinnitus relief course. Now, in addition to those 4 key elements, we've got things like cognitive behavioral therapy, linear, tinnitus retraining therapy. But it's important to understand that those treatments are much more effective when the 4 foundational elements are already in place. So today we're going to take a deep dive into sound enrichment. We're going to talk a little bit about changing our thoughts, and we'll also talk about the exciting new treatment option called linear. All right, so let's imagine we are in a pitch black room. It is so dark, I can't see my hand in front of my face, right? That's how dark it is. And I find a candle and I light the flame, right? I light it. And that flame is going to seem really, really, really bright in that dark room because it's so dark. But if I turn on the lights, the flame doesn't seem so bright. But did the flame change? No, the flame didn't change at all. Your environment changed. And that's when sound therapy can be introduced. The contrast between tinnitus and your environment can decrease it and make the tinnitus seem softer. So our goal is to train the brain to perceive tinnitus as a softer and less threatening. By consistently using sound enrichment over time, it's not right away, it takes time, we can help the brain to reframe its response to tinnitus. With regular sound exposure, the brain gradually learns to treat the tinnitus as less important, less noticeable, and eventually it's going to feel softer and far less disruptive. Now remember, the ultimate goal is habituation. We want the brain to treat tinnitus the same way it treats the hum of the refrigerator. It's there, but we don't notice unless we stop to focus on it. Using sound in your environment consistently can help make that happen. Now, when choosing a sound for tinnitus management, there's a few different options. We have soothing sounds. These are sounds that kind of help you feel calm and relaxed, like a babbling brook or the sound of the ocean. There's background sounds. These are more neutral sounds that help reduce the contrast between tinnitus and your environment. Think of the fan noise or white noise for background sounds. And then, of course, interesting sounds. These are sounds that catch and hold your attention, like watching TV, listening to a podcast, or an audiobook. Research shows that the specific type of sound does not matter. What does matter are 2 important things. First, choose a sound you actually want to listen to. You already have an annoying sound called tinnitus. You don't need another annoying sound, right? And second, use a sound that does not completely mask or cover up your tinnitus. Remember, the goal is habituation. You can't train your brain to tune something out if you never hear it. So you don't want the volume to be so loud that it masks or covers up the tinnitus. And of course, let's not forget about hearing aids. They can play a big role in providing sound enrichment, especially if hearing loss is part of the picture. Numerous research studies have shown that many tinnitus patients who also have hearing loss experience some relief from their tinnitus when they wear their hearing aids. Hearing aids are helping in two important ways. They enrich the environment with sound, so again, making tinnitus less noticeable, and they stimulate the brain with sound, which is critical. When hearing loss goes untreated, the brain isn't getting the sound input it needs, and in response, it can start to fill in the gaps by creating its own internal noise. This is one of the reasons untreated hearing loss puts you at a higher risk for developing or worsening tinnitus. Now, a lot of my tinnitus patients will tell me they have trouble understanding conversations in noisy places. And when we test their hearing, surprise, many of them have a high frequency hearing loss that they didn't even know about. In most cases, it's the hearing loss, not the tinnitus, that's making it harder to hear clearly in noise. Think of it this way. Your brain's like a muscle, and if you don't use it, you lose it. When your brain isn't getting stimulated with sound, its ability to understand speech can start to break down. But the exciting part is that about 60% of patients with untreated hearing loss and tinnitus see real improvement in their tinnitus just by wearing hearing aids. So don't wait. It's just like any other ailment. The longer you wait to treat your hearing loss, the more difficult it is to treat. Okay, so now besides sound enrichment, what else can you do to take control and start managing tinnitus? Well, education and counseling alone can offer relief for people. One powerful piece is that learning how to change your thoughts. So remember, what you think affects how you feel, and how you feel affects your health. Negative thoughts will lead to negative emotions, which can make tinnitus feel even worse. But when we shift how we think and how we view things, it can have a huge impact, not just on our tinnitus, but also our entire life. Change your thoughts, change your life. That's always my motto. Change your thoughts, change your life. So I'm going to give you a simple example. Imagine you're hosting a dinner party and your friends are running late. How you think about them running late will directly shape how you feel about it. If you think, oh, wow, that's rude, they have a phone they could have called, you're going to feel agitated or annoyed. If you think, oh gosh, I hope they're safe, there was such a really bad storm, you might feel anxious or worried. Or you might think, woohoo, I got extra time to clean my house, and you're going to feel relieved, right? In this example, the event is the same. Your friends are running late for dinner, but your thoughts can be different. Now, these thoughts are automatic. We didn't choose to have those thoughts. They just popped into our head. So that's why we got to pay attention to our thoughts. The same thing applies to your tinnitus. If you wake up and notice your tinnitus is loud and you think, oh, my tinnitus is loud today is going to be just awful. It's going to be such a bad day. Or you might think, wow, my tinnitus is louder today. It's a good thing I'm learning strategies to take control and keep moving forward. Which thought do you think is going to set you up better for the day, right? The kind of mindset work, this kind of mindset work is a key part of cognitive behavioral therapy, which is shown to be very helpful for many patients with tinnitus. But beyond cognitive behavioral therapy, there's also linear. And so linear is the first ever FDA approved here in the United States treatment specifically for tinnitus. It's really exciting. It uses something called bimodal neuromodulation, which is really just a fancy way of saying we're going to stimulate your brain in two ways. So through sound and through gentle electrical stimulation on the tongue. Over time, this dual stimulation helps to retrain the brain and push tinnitus further into the background, making it feel less intrusive and less bothersome. So again, linear works by combining sound stimulation through headphones and gentle electrical pulses through a small device placed on the tongue. It's used twice a day for about 30 minutes each time, typically over a 12-week period. Now, in clinical trials, about 80% of patients reported significant relief, and the improvements often continue even after the treatment ends. While linear isn't a cure, it is a powerful tool that can help retrain the brain and push tinnitus into the background, helping people take back control of their life. Now, typically, the best results come from combining several treatment strategies, not just relying on one approach. But the most important factor is making sure the plan fits your unique needs. I have patients who come in wanting linear, and they have a significant high-frequency hearing loss that has gone untreated. And when I ask them what are their goals with tinnitus management, like what do they hope to accomplish, they'll say, well, I really want, I want to be able to fall asleep more easily. I want to be able to concentrate, and I really want to hear better in noise. I'm going to say, listen, linear can absolutely help your tinnitus. It can help you sleep better at night. It can help your concentration. It is not going to help you hear better in noise. That's your hearing loss, right? So sometimes we do have to combine several strategies to get patients to where they need to be. So the exciting part is you don't have to wait to start making a difference. You can take action right at home starting today. Use sound enrichment every day to help retrain your brain and lower the focus on tinnitus. Practice relaxation exercises, calm your nervous system, and build resilience, and most importantly, reduce your reactions to tinnitus. Dive into an at-home tinnitus program like the one I created, or there's many others online. Get clear step-by-step guided um, a clear step-by-step guide packed with real proven strategies. Small, consistent steps lead to big transformations over time. Every action you take is a signal to your brain, I'm taking back control. And the best part is, you're already moving forward just by being here today. So now's the time for your questions. If we don't get to your questions, of course, just email me, tinnituswithmaria@gmail.com is a great way. You can follow me on social media. I post on YouTube, TikTok, Instagram, Facebook, educational videos on hearing healthcare every single day. And of course, I've got some free resources. Just email me, I'll send them to you. And don't forget, look up some at-home programs that you can do or visit a tinnitus specialist in your area. All right, thank you, friends.
Thank you so much, Dr. Morrison. That was so informative. And
I'm glad.
actually, I have a couple of questions for you. We'll see if anyone pops any questions on the live chat as well. I find it really interesting because I've actually had two conversations with my patients recently about that tone, essentially, that not the tinnitus, but that tone that we get that we all tend to experience. And I remember when
Mhm.
I first started learning about tinnitus and first started in audiology, I said to my supervisor, sometimes I just go like deaf in one ear and I get this ringing sound. What is it? There was sort of no answer. So if you telling me, oh, actually, there's this sort of this like theory behind, oh, actually,
That's the
it's
theory. Yeah.
I find that really interesting because I actually had this conversation with two tinnitus patients
Mhm.
recently, and just want to sort of your opinion on this really. So both of the patients had the same concern,
Mhm.
have standard tinnitus. We're treating them for standard tinnitus, but they get this additional tone every now and then,
Mhm.
and there's that fear that oh, what if this is something else? What if this stays? What if this
Yes.
changes my
Yes. We
tinnitus?
start snowballing into those negative thoughts. Right. Yep. 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 Yep.
And so what would you say to those patients if they're experiencing this problem?
That's a great question, Joanna. Certainly every patient is different and how you approach situations can be different. But I always first start with, well, has that happened in the past where you heard it and it completely affected everything in your life? No. Well, then what makes you think it's going to happen now? Like, where's the historical evidence that this is going to happen, right? We're like this negative forecasting of things that we feel like we can't control. And so I always, try to bring patients back to what can we control? We can control the hearing protection we use when we're in loud environments. And I do talk to patients about you don't want to overuse hearing protection, right? Because the more we use hearing protection and we're in quiet and we don't stimulate our brain, it can actually make tinnitus worse, right? So we
Yeah.
don't want to overuse hearing protection. Luckily, we all have these lovely little computers that you can turn into a sound level meter, right? And so if it's not loud, you don't need hearing protection. If it's loud, you should wear hearing protection. And just reminding patients, you might think that your lawnmower isn't that loud. And maybe you're only using it for 45 minutes, every other week or whatever. But if you measure it and you find that it's actually 95 decibels, that's pretty loud. And
Yeah.
you should be using hearing protection, right? So we give a handout that shows like how loud is too loud, 80 decibels, 85 decibels, and how long you can listen to that level of loudness before it's going to cause any damage. And we download an app so they can use their phone as a sound level meter and they can use that. But really, it's focusing on the historic of their life. Like, why do you feel like this is going to happen? It hasn't happened yet. It's probably not going to happen. And then if you are worried about it happening, what are things that you can do to control that? And really, it comes down to hearing protection.
I think that's really important. And that's another conversation that I've been having recently. And I think it's almost a generational thing that actually it's almost it's become sort of cool again to protect our hearing
Yeah,
and to,
finally.
yes, yeah. And possibly that's education because for some time we didn't realize the impact
Yeah.
that noise had on our hearing systems.
Mhm.
But I feel like this new generation that's coming through, they are realizing that the decisions that they make when they're young affect them as they're older.
Mhm.
And they're much more aware of the impact that their decisions make, which is amazing. And I was speaking to someone recently as well because we were talking about hearing protection, and I'd seen that Coachella were advertising with Loop. They'd
Yep.
created their own Loop earplugs,
Mhm.
and I was like, "That's amazing!" This
Yes.
massive festival that is recognizing that
Yeah.
actually protecting your hearing. You can come along, you can do this festival. It's amazing,
Enjoy
but
it.
yeah,
Yeah.
do
Yeah.
it safely and
Yes.
that's amazing.
Yeah. Yes,
What
it is.
I love the fact that you give patients these levels, safe levels
Mhm.
of noise, and you said that you use an app. Is that just a generic app that people can find?
There's many. I mean, you can just Google search like sound level meter app. The one that we use here is the NIOSH. NIOSH is an acronym for, almost like OSHA here in the United States. But it's a free app and you download it and then you can just start it and it'll tell you how loud it is. And it gives you too the average, but also like the softest and the loudest sound. So you could have been exposed to that loud sound only for a second, but it did get that loud. Yeah.
Amazing, that's great.
Yeah.
My other question was obviously you said that you have been in audiology now for quite some time.
Mhm.
What do you feel are the biggest changes within tinnitus that have come across over the since come into
Oh,
audiology?
well, I will tell you the biggest change I've had in my own thinking was I truly believe we're all born with tinnitus. And I think it's just in the subconscious part of our brain, and something forces it to come to the conscious part of our brain. Because I could have a patient who, normal hearing, young, very healthy, never had tinnitus before. He could be on the phone or just talking with someone who is complaining about their tinnitus, and now my patient will hear tinnitus, right? Or another patient, again, no medical history, beautiful hearing, and read an article about tinnitus, and now they hear tinnitus, right? And so I do think it's just there in the background. Something is going to force it to come to the conscious part of the brain, whether it's hearing about it, learning about it, going through a stressful event, but if we can get information out to people before it happens, then when it does happen, they're going to realize it's not important. It's not something that I need to worry about. Unfortunately, there's so much negative information out there about tinnitus, about how it could be so impactful, and oh, if you get it, your life is ruined, and that's not true. And if that's the story that people hear, that's what they're going to believe. And so then when they do hear tinnitus, well, guess what's going to happen? Yeah, they're going to be significantly impacted by it. And so for me, it's just getting that information out there to the masses, to consumers, to physicians, ear, nose, and throat physicians. If any ear, nose, and throat physicians are watching, please stop telling patients, just get used to it. There's nothing that can be done, because that is not true. And it is completely not helpful. It can actually make it worse for someone who goes to an ear, nose, and throat doctor and says, I've got this ringing in my ears. It's really impacting my life. And they're going to say, okay, we're going to do a hearing test. Oh, your hearing is normal. Maybe we do an MRI. No, everything looks good. Just get used to it. It'll go away. Like that is just going to put someone in a negative spiral. So I think, again, just getting people educated is really what's needed right now.
But yeah, and that's it. I had a patient recently, and they'd been an audiology patient of ours for quite some time, and then they had tinnitus. And I sat down, and they'd seen lots of audiologists, and I thought, let's just start right back at the beginning.
Mhm.
And we had a
Boy.
conversation, talked about why we experienced tinnitus, did a new hearing test.
Mhm.
And at the end, the patient said, nobody's ever gone through this
Yep.
with me. And
Yep.
they'd been a patient for years
Yeah.
and years. And it's having that assumption, well, somebody else must have done that.
They
Somebody
haven't.
else, and nobody has. And
Mm-hmm.
they've seen count,
Yep.
ENT specialists, different
Yep.
audiologists, and actually just doing that, this knowledge,
Yep.
okay, yes, this is something that we don't have a cure for, but we can help you manage this. And
Yeah.
these are the reasons why, and this is the reason why
Yeah.
you're experiencing tinnitus. And as you
Yeah.
said, knowledge is power. The more we know,
Yeah.
the more that we can do.
Yeah.
And it's sometimes just taking it back to basics and
Mm-hmm.
saying, right, okay, actually, do you know this? No, let's
Yeah.
go through this
Yeah.
then. So,
Most tinnitus patients that come into the office don't need anything more than that initial consultation. I mean, that's all they need. They need that foundational information. They need to understand why it's an issue and how we can get it to be not an issue. There are some that are severely impacted, right? That have anxiety and depression along with it, and they're going to need more help, and they're going to
yeah,
need the linear, they're going to need tinnitus retraining therapy, cognitive behavioral therapy, right? That's why we have those. But I think so many audiologists get nervous or worried about seeing tinnitus patients because they feel like, well, I can't do all those other things. That's okay. Just provide a good foundational appointment. And then if they need something further, absolutely then refer them on to someone else who can do it if you're not equipped to do it. And that's really why I created that course, because it was just, I couldn't believe the amount of bad information my patients were getting from their audiologist that they saw before me, right? And so just trying to get that out there, getting audiologists to feel more comfortable with seeing those patients and making sure that they're covering that information that's so critical for them.
and can anybody access this course then?
Yes,
Or is
it's
it just
on.
people in America?
No, I mean, it's on Audiology Academy. It's called How to Easily Set Up Your Tinnitus Clinic. Anybody can access it. You have to pay for the course. And there's modules in there on, marketing. There's modules on billing, so billing codes, which may or may not, be appropriate depending on the country that you're in.
Yeah,
But there's a PowerPoint presentation that I give so that you can walk your patient through it with the PowerPoint presentation. There's scripts for each slide, why we're going over, what we're going over. There's a video of me doing it with someone so that you can really get a good sense of, well, how do I do this when a patient comes into my office? Yep.
amazing. Because
Yeah.
like you said, it's not just, it's education for healthcare
Yeah, it's not just a
professionals.
hearing test.
Yeah, yeah.
Unfortunately, I mean that's the start, right? But we need to build on that. We need to do more than that. Yeah.
And I really liked this changing thoughts, and that's obviously our focus with Hishio
Mm-hmm.
International in terms of CBT. But
Yes.
there are lots of ways that patients can change their thought processes about their tinnitus.
Mm-hmm.
And as you said, and a lot of what I'm seeing at the moment is that targeting of going, right, okay, don't just say there is no cure. You have to learn to live with it. How can I do that? Give them that
Yes.
extra.
Yes.
Because otherwise patients have that negative thought of, well, that's it then. I have to live with this for the rest of my life.
I can't
And
do that. I can't live with this forever. I'm never going to enjoy quiet again. It's only going to get worse, right? Yeah. Yeah.
And,
Absolutely.
having that education, patients then can
Hmm.
change their,
Yes.
thought process of, well, actually, yes, I do have to live with this for the rest of my life, but this is how I'm going to do it.
Yep.
And that's just it's so much more progressive to
Hmm.
have that education for a patient, which is, it is amazing. So patients can see you. You've shared your links, but you
Hmm.
do sort of educational videos. Can children watch those as well? Can families with children, is it helpful for them?
Absolutely. I mean, any age. I mean, obviously, I would say a family with a small child, you're going to want to watch it with them. I don't see children here at my clinic. I mainly do teenagers and above. I don't see the really little ones. But yeah, in Illinois, I'm only allowed to treat patients who are physically in the state of Illinois. So I can do telehealth, but you have to physically be in Illinois. And
Right.
so that's really what drove me to create that online tinnitus relief course because I'm on social media, I get calls from people all over the world.
Yeah.
Some of them who don't speak English, and so that's always a lot of fun. Is getting that part down. And it was just clear that there's a need out there for help, and so that's why I created that course. And it's very inexpensive, and it's 8 modules long. And I recommend patients do 1 module a week. So the idea is you're going to learn a topic, you're going to learn some information, and then you're going to start implementing it through that week. And then we're going to build upon it and build upon it and build upon it so that by the end of the 8 weeks, you're in a really good situation and you've already starting to notice improvement in your tinnitus. Yeah.
And patients who want to do that course, they
Mhm.
can get the information through your social media.
Yes, it's on my social media. They can also email me. Yep. But yeah, on any of those Instagram, TikTok, Facebook, YouTube, there's a link that they can do it straight from there. Yep.
Amazing. And
Yeah.
essentially, although you're recommending that you do a module a week and sort
Mhm.
of work your way through it, it's when it suits them. They can
Of
sign up.
course. Yes. I've had patients do the whole thing in 2 days and they tell me it's so much better even just after 2 days. I'm like, that's great. It's just, there are some habits that we're trying to create.
Yeah,
And when you try to do it all at once, I feel like it can be really difficult to keep that long term.
yeah.
But if you can do it, that's great. Absolutely go for it. Yeah. And you can
Some
always go back and watch it again. Yeah.
Oh, excellent. That's great
Yeah.
news. Yeah, some patients just have that enthusiasm and that
Yes.
motivational drive, don't they? They just want
Mm-hmm.
to get it all done.
Get it
Um,
done. Yeah.
it's the same with our we do an ICBT course
Mm-hmm.
with Hisherian International, and you get some patients that do it all in one
Yes.
day. And that's great. The enthusiasm is amazing.
Yeah.
But as you said, actually the idea is to have do a module, put some of that into practice,
Yes.
give that
Be
some
intentional
time.
with it. Yep. Yep. It's not just watching the videos. You have to put it into practice what you're learning.
Yeah.
Yeah.
And that's a question I get quite a lot when I do assessments. Well, how successful are you? And I'm like, well, my job is to teach you. My job is to give
Mm-hmm.
you the information and the resources. Essentially, it's down to you. I've
Mm-hmm.
got to find the best way to motivate you and get you to do it, but you're the one who has to put this into practice.
Yep.
And the patients that put the work into practice, they're always
Very
successful.
successful. Yep. Absolutely. I've had patients come in to purchase Lanier, and yes, they're a candidate for Lanier, and they buy it, and it's not cheap. And then they come in for their follow-up and they haven't used it. Why on earth
Yeah.
would you spend all that money and then not do it, And, those are the people that are just like, I just want to spend, here's the money, make it go away. And
Yeah.
it doesn't work that easily. I wish it did. It
Yeah.
just doesn't. Yeah.
All of our patients, wish there was a pill and
Yes,
their
of course.
tinnitus would
Yeah.
be gone.
Yeah. Yeah.
But, and a lot of patients do sort of think, right, okay, well, I'll pay for this or sign up for this,
Hmm.
but it is about that, having the motivation to put the work in,
Yeah.
and to do that and to continue to do it because
Mhm.
it's not always, it's not a quick fix. It's not about doing a course, completing it and going, that's it right now.
Right.
I'm
Hmm.
cured. You may
Yep.
well notice a big benefit in your symptoms in that time,
Yep.
but we all know that we get, as you said, stress is a huge impacting
Mhm.
factor,
Yep.
medication. So we all get these changes within life circumstances that can change our tinnitus or where we've been managing it really well exacerbate that tinnitus,
Yeah.
so it's that ongoing
Yes.
um knowledge and use of that knowledge that is going to impact patients the
Yeah.
most.
Just around 2 in the morning, I swore someone was breaking into my house. My dog was going crazy. I was hearing sounds. It was just my teenage son, but at the time I didn't know. So of course, like I was worried. I was scared. I didn't know what to do. And then obviously once I found out everything was good, sure enough, I could hear my tinnitus. And I'm usually pretty good. I don't normally notice it on a day-to-day basis, but I was like, do I call 911? What do I do, right? I was definitely nervous. And so that, right, that event is heightening my fight or flight system, the stress response in my body, my cortisol is up. Yeah, of course, you're going to have these moments that are going to impact your tinnitus. And that's when you have to remember, go back to your training and start implementing those strategies again.
Yeah,
Absolutely.
and that's why it's so helpful, isn't it? And I get intermittent tinnitus, and the last time I had it was when I went into labor with my youngest, and I was like, oh my gosh, and I was like, you're just very stressed right now.
Yep. Absolutely.
And
Yep.
actually, my mind was on a lot of other things. So eventually,
Yeah.
it disappeared, but or it was
Yeah.
there, but I just didn't notice it. But like you said, it's bringing that go, right, okay, you know how to deal with this.
Yes.
Don't panic, use the
Exactly.
tools that you
You've got
already
it.
have.
Hmm.
And it is understanding that. And actually, like you said, sometimes it's our body's way, our brain's way of going, there's something else that you might
Hmm.
actually need to look at that's
Yeah.
triggering this to be worse at the moment.
Yes. Yep. Absolutely.
Amazing. Thank you
Mm.
so much for joining us, Dr. Morrison, today. I
Well,
really
thank
appreciate
you.
it. Your um, presentation was really informative. So thank you for sharing that with us. If
Thank you for
anyone is
having me.
having problems with any of the issues that we've raised today in the patient education program, please feel free to get in touch with us. Dr. Morrison has also shared all of her details on here, so please feel free to email her and have a look at all of her socials as well. I know I'll be having a look at your TikTok videos. That's something that I'll
Excellent.
be looking at. And thank you again, everyone, for joining us this evening.